Let's start from the absolute basics. Before you diagnose a heart attack or an arrhythmia, you need to recognize a normal ECG. The first thing you should look for is the P wave. This small bump represents atrial depolarization. In simpler words, it means that the electrical impulse is spreading through the atria, causing them to contract. Next comes the PR interval, which is the time taken for electrical impulse to travel from atria through the AV node to the ventricles. And normally it should be between 120 to 200 milliseconds. After that, we see the QRS complex, which is a sharp spike that represents ventricular depolarization, the moment when the ventricles are activated and contract to pump the blood to the body and lungs. A normal QRS duration should be less than 120 milliseconds. Following the QRS complex is the ST segment. In a normal ECG, the ST segment should be flat and lie on the baseline. Elevation or depression can indicate important pathology. Next comes the T wave. The T wave represents ventricular repolarization, which is the recovery phase of ventricles as they prepare for the next heartbeat. And then finally, we look at the QT interval, which represents the total time taken for ventricular depolarization and repolarization. So remember the sequence. P wave is atrial depolarization, PR interval is AV conduction, QRS complex is ventricular depolarization, ST segment should be isoelectric, T wave is ventricular repolarization, and QT interval is total ventricular electrical activity. You have to master these normal components first, and interpreting abnormal ECGs will become much easier. This ECG, P waves are highlighted by greenish color, QRS complex is highlighted by pink color, and T wave is highlighted by blue color.